El pasillo ya te van a tomar fotografías, ya que te las tomen, regresas aquí. No puede ser. Oh, you want to wait?
No, wait. How you feeling, bro? Okay, you still doze up. Hmm? Hey, you got a nice view though. Ya te voy a decir gorda. Sexy mama. Vamos a decir lo que tú digas, ¿ok? Yeah? You want to throw up?
No, I'm just starting to feel nauseous, like nauseous. But she let me
Ahí va a atorar el throw up.
well, my stomach's empty. But it's probably just a feeling. I think she said she gave me medication for nausea. I think. I didn't stay at the clinic yesterday. I didn't want to stay there because nobody could stay in there with me. And I didn't want to stay there by myself. I didn't know when I was going to start feeling pain, and I didn't want to be in pain there and then on the drive home be very uncomfortable. So since I was still feeling okay yesterday, I asked the doctor if I could leave, and he said it was okay. The anesthesiologist said it was okay. So I ended up getting discharged like around 8 at night because I was feeling a little dizzy, and I did throw up once after they gave me Jello and apple juice. I threw it up. So after that, they once I wasn't dizzy anymore, they discharged me, and yeah, I got home like at midnight. I did stop and eat 2 tacos. I normally eat 4, but I ate 2. Anyways, so today, I felt fine this morning. I've actually haven't had any pain, which is good. But today I did want to shower because I was full of like the liquid and blood and everything that drains, and I felt really nasty, so I wanted to shower. I did see in a lot of videos that people say they faint or they feel like they're gonna faint when they shower, so I kind of had that in mind, but it was so bad. I took off the compression wrap and I started feeling lightheaded, but I just wanted to get in there and just get everything off of me. And so I sat on a chair and I felt really, really bad. Like like my blood pressure dropped, like I was gonna faint, and I just leaned my head against the shower wall, and I started feeling okay. So then I decided to stand up to, lather myself with soap, and I don't remember fainting. I don't remember anything. I don't remember feeling like I was dizzy, feeling like I was gonna faint. I woke up and my boyfriend was like holding me on the floor, and so right after that, don't know if I fainted again or I went into a deep sleep, because I remember dreaming something, and he says I was snoring, and so he was able to wake me up, and right after that I got out, It was really bad. And then I had to put the faja on for the first time. But after I put that on, oh my God, it felt so much better. And they do say once you put your faja back on, you will feel so much better. It's true, but yeah. I haven't had like really bad pain. I have soreness when I move around, but it's not that bad. I was expecting the worst pain today and tomorrow. Maybe tomorrow it'll be worse. But today's not that bad. I've been able to eat today. I did feel nauseous once in the morning when I got up to go pee early in the morning. I was fine. I walked to my restroom, and when I got off the toilet, I started feeling a little dizzy. So yeah, when I got back to the bed, I was very nauseous. And so I just laid down and I went back to sleep, and I woke up and, then I showered and all that happened. But yeah, so I'm tired of laying on my stomach. Oh, when they took me out of surgery, I was on my back, and when I got to my room, I asked the nurse, is it okay to be on my butt? I said I don't want any of it to go away, because I did ask the doctor for something natural, so it's not gonna be a lot. And I'm like, man, then I regretted it. I'm like, I should have gone bigger, it's already there. But anyways, I did ask the doctor for something very natural. I actually didn't want it bigger. I just wanted him to fill in like the side of my hips where I had like a little indentation, and my butt on the lateral side. So I pretty much just asked him to fill that in. And I kind of regret it. I should have said to go bigger, because I've heard that your body only retains like 60 to 70% of the fat. The rest of it dies. So anyways, when I got back to the room and I was on my butt, I'm like, I don't want any of it to go away. So she said it was okay. I was still a little skeptical. That's why I was like, no, I want to go home. I don't want to be on my butt. And so when the doctor came in, he came in to check on me, and I asked him to. I'm like, is it okay to be on my butt? And he said, yeah, it's fine. He's like, yeah, you can be on your side too. Just put a pillow right above your hip. And I was like, okay, but I'm not taking any chances. I've been laying on my stomach this whole time, and it's so tiring. So right now I'm sitting on my BBL pillow, but yeah, it's tiring. And yeah, what else has happened? It's pretty much it. In the moment where I was feeling, when I took off the compression garment right before I showered, of course I had the feeling of regret, because the feeling is horrible. But like now that it's all gone, I'm like, no, I don't regret it. And I don't plan on showering in the next 10 days. I'm not even fucking kidding. I'm not planning on taking off this faja at all. I don't care how bloody dirty it is. I'm not taking it off. But yeah, no, I probably will to wash it and change it, but in a good 5 days. But yeah, other than that, it's pretty much everything that's been going on. You can see some bruising right here. But yeah, there's definitely more bruising. This is the faja, and I put the straps over my shirt because they were really irritating my skin. But yeah, so you can kind of see a little bit of my hips. And I'm gonna look for some pictures. I didn't take any pictures before to show you guys, but I already had hips. I just had like a little indentation right here, so my hip started here, and then I had a little indentation right here that went all the way to my buttocks right here. And so I asked him to even it out and obviously fill in right here. And so I already had a butt. I'm gonna try to find some pictures. So I just asked him to fill them in. So yeah, and then I definitely had love handles here. And like I said earlier, the pain is not bad at all. I don't know about tomorrow or the following day, but yeah. So I still have under this faja, I haven't put the foams on yet. They told me tomorrow to start using the pads on the incision sites and the foams. But I have the bed pads, things you use for bed pads. See, I don't know if you can see, but that's my butt and it's bruised right there. So this is the bed pad. It's the plastic one they used to protect the bed. See, it's kind of all messed up in there because we couldn't really get it in there. And I don't have tape. I do have tape, I just couldn't find it. I have paper tape, but so we weren't able to tape it. So it was all over the place. It was a mission to put the faja on, and it was right after my shower, and I felt like I was gonna die. So at that point, I didn't even care. I just wanted it to cover the incisions that were draining the most, which is this one and this one that I noticed that were leaking. But yeah, I'm super swollen. My eyes are swollen. My hands are swollen. Yeah, but I'm sure all that pad is crumpled up here too. Oh, I still look fat. But yeah, I was fatter before, so I'm not sure how many incision sites I have either. I know I have one under each breast. I have some down here, I don't know how many, and I have one under each buttock. I know that. I know I have some on my back because my boyfriend told me, like my upper back. But I'm not sure exactly as to how many I have. And I didn't end up doing my arms because the doctor said that I do have fat, and there was fat that he could remove. However, he said that it was very little, and he said that my arms right now are proportioned to my body. So because I told him I didn't want to end up with skinny little arms if he takes out all the fat, and I'm not skinny, you know. So he said he thought they were fine, and they went with my body. Even though there's a little fat, it's not that much. So I ended up leaving my arms, and I'm kind of thankful right now because I'm able to get in and out of the bed, and obviously I have to use my arms. So I'm like, man, if I would have done my arms, I wouldn't even be able to do this. So yeah, but been able to go to the restroom fine. The only time I needed help was with that shower that I freaking passed out, and yeah, it was horrible. That was horrible. That was the only time I was like, man, this isn't worth it, but it is. It's only a few minutes, and yeah. So yeah, I will try to take pictures of the bruising tomorrow. Today, like I said, I felt like shit, so I just wanted to get this faja on and feel better. And yeah, it's true what they say, when you take it off, you feel like you're falling apart. As soon as you put it back on, oh my god, you feel together again. And so yeah. Hi guys, today is day 2 post-op. It is Sunday. I had surgery Friday. I'm definitely more swollen today and more bruised. The bruising starting to really come in. As far as the pain, I don't have any pain. I am more sore though, so now I feel the soreness. I had my dressing changes this morning. My friend Evelyn thank you, came today to clean all my wound sides and change my dressings, and so we did all that today. And I put the lipofoam on today. I'm having a hard time moving now because I am sore, so I do feel that soreness pain. I put these here because they were bugging me, but I don't know if you can see that bruising, and then you can see some on this side. So my abdomen and all that is definitely bruised. I'll try to insert a picture if I can. But yeah, it's day 2 and not much happening today. I will keep you guys updated.